So after suction, we start with the refractive cut, the most important, can't lose suction here or smile can't continue. Then the quick side cuts, and then the cap cut, which will extend over the edge of the side cut a little bit. So here you can see it how it hangs over a little bit anteriorly, and then the cap opening, which is superiorly located. Then we switch to the microscope view, and using a pair of forceps to stabilize the eye, the Sinski really hugs that cap cut wall, and we lift the Sinski upward, and now we're really anterior to the lenticule, and then across the whole cap opening, and now we reach posterior to the lenticule along that refractive cut interface and just open up a little bit to allow a pathway to get to later. So now we take the other end of our instrument, and the goal will be to dissect the cap cut all along to the edges here. So this can be accomplished in different ways, of course, and different speeds, and as few as maybe 3 swipes, but we're hugging that cap cut wall and really sweeping over. A drop of BSS on the cornea again can help with this. And we're hugging that cap cut wall, totally freeing the anterior surface of the lenticule. So now the lenticule is free anteriorly, and we've dissected all along that anterior cap cut. Now we're going to reach in that pocket that we made posterior to the lenticule to dissect along the refractive cut. So now we're in that posterior space. It's very important to be in the correct planes, and we're leaving that little tag to the left there near the cap opening, and we're freeing the rest here, and you'll notice we'll leave another tag next to the cap opening on the right hand side here as well. So again, we're freeing past all the way back out to that cap cut, so the whole lenticule is really being freed now. And those 2 tags there are what are giving us traction, so this dissection can be smooth. And now we can free that tag, that right hand tag, and now we can free the left hand tag. And we can also lift up with the instrument to help get the lenticule out, but here there was enough where we can just grab it. Make sure not to tear anything, of course. So we take the forceps, pull the lenticule out, lay it on the cornea, and make sure it's intact so there's no tags or tears. That looks great. Then this part is optional. We can irrigate the interface, very, very gentle, way less fluid than with LASIK, for example. So we don't want to cause any edema within the cornea, so that's just barely any irrigation. And then hydrating the anterior cornea one more time to flatten that interface. And this patient was 2015 the next day, so SMILE is a great option with great outcomes. We give a drop of antibiotic steroid, and then that is it, real-time SMILE.